Great. Thank you. So good morning, everyone. Ooh, well, that's interesting. Hold on just a second, because I'm going to have to change the computer angle because my slides are on a shared screen, which is not the screen where all of you are. Can you see my slides? Yep, excellent. That's interesting. That hasn't happened before. So good morning, everyone. My name is Sara Dugan. As was mentioned, we're going to focus today's discussion on shared decision making, specifically related to decisions surrounding medications. So I've got three objectives that I hope to cover. So listing the steps in the shared decision-making process. For a number of you, this may very well be a review, but just to make sure that we're pretty concrete, to describe how you might be able to incorporate this into your practice. And I want to discuss some examples of how shared decision-making can be used with medication decisions. So identifying certain areas where considerations related to medications really could be introduced to help support these patients, their families, and caregivers, as well as their treatment team, because if we're not on the same page, that can be super frustrating. All right, so I wanted to start with what's shared decision-making. So definitions first. Shared decision-making officially is an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences. So it's an interactive process where patients and family members or caregivers and the treatment team all work together to come to a decision. Now, the decision does not have to be medication related. There are quite a few articles that are available related to shared decision-making that actually focus on testing, whether or not to get different types of testing, whether or not to do different types of interventions. So it really could be used in broader context. We're just going to focus on medications today. So step one is confronting a decision that needs to be made. This could be related to starting a new medicine. Is it time to start a new medicine? Is it time to change the medication that we're on now, be it change a dose, change when we're administering that medication? Is it time to add something different, to swap to something different? So what exactly is the decision that is being made? Once we have that point where we recognize that there is a decision to be made, this is an intentional process. And I'm going to encourage you, or I guess challenge all of you, to really help some of the family and caregivers of the kids that you're caring for to really think about trying to use steps of this process. I think sometimes we just want to get stuff done, but really taking a step back and being intentional may make this a much more efficient and satisfying process for everyone involved. The three steps are preparation and information gathering, discussion and generation of a decision. So step two is the main point that we do get to a decision. And then step three being reevaluation and revision. And I think that's a good reminder that none of these decisions related to medications are set in stone. They're things we can go back and revisit. And it's something that we should do often, is go back and revisit to make sure it's still the best fit for that particular patient. This is not my graphic. It's one that I borrowed from the shared decision-making literature, but I thought it was a helpful depiction. So our three steps are in the three circles. So preparation and information gathering, that's where we're about to start with the purple arrow. Discussion and generating a decision, and then reevaluation. So recognizing that we could go from one step to the other, but there may be instances where it's appropriate by this arrow right here to go backwards. So maybe we do need to take that step back during the discussion and trying to come to a decision. Maybe we realize that, you know what, we're not prepared and we need more information. So sometimes that may be the step in order to complete the whole process. Thinking specifically about the preparation and information gathering step, we may skip this or rush this step in many of the decisions that we make. Considering how involved do these individuals want to be related to the medications? I'm going to focus on medications because that's the focus today, but related to any of their decisions. With medications, there are going to be some individuals that you encounter who want nothing to do with that process. They may defer to their treatment team and say, you know what, whatever the prescriber says, that's what we're going to do. That's what we feel comfortable with. And that's completely fine. But making sure that that's where the patient and the family or caregivers are is really essential, because if they revisit it and decide that, you know what, I do want to be involved in that process, we need to make sure that we give them that opportunity. Their participation and capacity to participate do need to be taken into account. I guess I don't want to overlook that. There may be instances potentially where parents aren't in the best place to be able to control some of those decisions, but it doesn't mean they can't still be part of the process. And I think their feedback related to that could be really helpful. So if you have parents with maybe a history of substance use disorder that are in the process of getting custody back, and maybe there's a whole bunch of medications that their children are on, their child is on, and some of them may be controlled substances. So maybe they're on a benzodiazepine, or maybe they're on a stimulant. Maybe there's concern on the parents' part about having these medications in the house, being temptation or diversion for either themselves or other individuals who may come by. So recognizing and being able to hear some of those, we may be able to put other things in place to say, okay, if that's a concern, here's what we can do in terms of different types of packaging. Can we get this locked up? Can we have it put somewhere else? So really helping to work with them and identify that, okay, maybe we're making the decision that they can't make the yes or no decision on, but we can respect what their concerns are to make sure that it's effective and efficient for everyone moving forward. As we're doing this and we're preparing and gathering some of the information, any of the concerns that are raised, it's helpful to brainstorm. Any and all options should be on the table. This is tough to do. And I think it might be a good exercise as a treatment team, and especially in collaboration with the patient and their family members, to just say, what are our options? And they can run the gamut from, we're not going to start medication, we're going to start multiple medications, to anything in between. Nothing's off the table. So maybe it's prescription medication, maybe it's over the counter, maybe it's going to be an alternative medication or an herbal product or a nutritional supplement. Let's just put all of our options on the table so that we can discuss them. And then when a decision is made, we know that we've covered all of the potential basis. Even if something sounds outlandish, sometimes it's nice to have that there as kind of an anchor to be able to reflect from. Recognizing that and putting those options out there can help uncover other questions that patients and the families need answered. So that's one of the reasons not to shut down some of those outlandish things. So I'm really challenging you to dig deep here, really think about all those things that the patients and families need, and recognizing that we might need some supports in this area, things like decision aids, additional resources that can help both the team as well as the patient and the family get to their decision. In doing that, one way that this could be accomplished is having a shared decision-making worksheet. So something that's filled out. This is one that's used by our first program. If you just Google shared decision-making worksheet, there are at least 50 different templates that are out there and available for all kinds of different decisions. You could use one of those, you can make your own, but sometimes that documentation is helpful. So if we recognize what the goals are, list all those options and start looking at the questions, we have something to go back to in that third reevaluation step. This may be true, especially for folks that may seem to change their mind or be inconsistent or maybe forget and be overwhelmed by all the information and maybe need that reminder written in black and white. From a medication perspective, some things I would encourage you to really have the patient and family member think about. So if we're starting a new medicine, what is it that you're expecting? Are there specific symptoms that we're targeting? If we have an individual who's being defiant, who's 14, I have a 14-year-old, is it realistic to think that, you know, the defiance in pushing limits is going to go down to 0? Maybe not, because developmentally that's where they are. So maybe the defiance isn't what we need to target, but maybe it's the irritability or the aggression that happens as a result of encountering some of those boundaries. So that can help clarify the symptoms that we're going after. That also helps in terms of follow-up, so we can determine whether or not things are effective. We need to know what the expectations are. Do they expect this to help with the anxiety immediately? Because that's probably not going to happen with a number of our antidepressant medications that we use for anxiety. Are there certain side effects they're really concerned about? Is weight gain an issue? Is sedation a big problem? Are we worried about patients getting dizzy? What are the things that they're worried about so we can ensure that we're monitoring, screening for those and preventing them if possible? Are there other concerns? Are they worried about the financial status? Is this going to be covered? Is there going to be a safety issue with having some of these medications? Or maybe is there going to be a diversion issue with some of the medications being available? And then is follow-up a potential obstacle? So if we have a complicated regimen that's going to take maybe a few different steps, is that going to be a problem, especially if they have to travel pretty far for some of those follow-up appointments? So that can really get some of the items and issues out on the table so everyone can make a good informed decision moving forward. And so we're all on the same page. Same page would be moving to the next step. So discussion and generating that decision. I think this part may be challenging sometimes. So reviewing the information, those questions that were generated, can we make sure that we're all on the same page in terms of what would this mean going forward? If we start no medication, then the expectation is that maybe they're in therapy multiple times a week. They're doing IOP, or we're trying to get them in-home behavioral therapy options. Maybe it is starting medication. Here's what to expect and what needs to happen. Maybe it's going to be a combination of things. So really reviewing what would happen and what those answers are. If we start this medicine, here's the risk of that side effect of weight gain. And here's how we're going to screen for it so that everyone knows that, yes, if we go down this path, yes, it's a risk, but here's how we're going to try to prevent that as much as possible. Doing this in a informed way, but also a non-judgmental way. Ultimately, the patient and the family, if they're the ones who are going to be actually administering the medications themselves at home, they're overseeing it. They're the ones who have to implement this. So if they're not on board with it, then it's not going to go forward. And if we know that because they're uncomfortable now, that could prevent us from losing months of time when we thought they were taking it, but they're not, because they never actually started it because they were worried about this. And we didn't realize how worried we were, but maybe that eroded some of the relationship because they didn't feel heard that their concern about weight gain was a problem. So really kind of making sure that we're discussing those options. Doing that, using a decision guide and some of those decision aids, again, a concrete example can be helpful so that we can get to the making decision part. In terms of medication considerations, this can help your team make sure that everyone's on the same page. We're all saying the same thing. This medication, we're using it to help with the anxiety. Here's what we would expect to happen. Making sure that the concerns are voiced and addressed, that they understand that, yes, I know that you're worried about weight gain. We're starting an antidepressant that could cause weight gain, but here's what we're going to do to try to minimize that as much as possible, or stop if we start to see that. Documentation can make sure that there's no confusion or you never told me that type incidences. And it helps with the respect for the decision. Here's what we talked about, and here's essentially what has been decided and how we're moving forward. So by doing that, some resources that can be helpful, there are a bunch of decision guides. I like the Ottawa one, but there's a bunch of others as well. So you can narrow down the options. Okay, the combination of therapy and a medication is not going to be realistic. So it's either going to be therapy or a medication. And the medication can be A or B, and we can list those out. And they can start writing their pros and cons so that we can really see where they stand in terms of these different options. And it may help them build their case for why they're making the decision that they're making. Sometimes they need extra support. So there have been resources put together that help with comparisons of some of the weight gain so that people can see it more in a in this type concrete sense versus just looking at numbers or hearing, well, it's likely, but maybe not possible for everybody. So I think sometimes that can be super, super helpful. And then our reevaluation. So making sure that we check back. We're going to do this. Let's do it for a set period of time. You're not stuck with it for, the next 4 or 5 years. Let's do this for the next 3 months, and then we'll come back and really consider whether or not this is doing what we wanted it to do. Recognizing that trial and error may be necessary. So some of our medications, like antidepressants, they don't work for everyone. We're going to try this. It's going to take a couple months before we could see efficacy. If it doesn't work by June, you know what? At that point, we're going to discontinue this and we'll move to something different. That makes sure everyone's on the same page. So if they expect this to work quick, like a stimulant for ADHD within the first week of treatment, the first doses of treatment, then we've gotten rid of that inconsistency, that lack of communication, because they may be willing to ditch the Prozac right away because, hey, I don't see a difference like I did when they started their Ritalin, and making sure everyone's on the same page. And that may buy us time too, to make sure that they're committed as long as we need them to be for their medications. It's always a work in progress, just like all of us. So in summary, patients and families and caregivers really can play a big role in implementation of medication. And shared decision-making can be a tool that we use with a whole bunch of resources and supports. So that may make your jobs a little bit easier. It may make communication smoother across your treatment team. And ultimately, the goal would be to improve care for those patients. With that, I will stop my share and turn it back over to you, Mike.